Hello everybody, my name is Chris Boyman. I'm going to be speaking with you today on how to identify some signs and symptoms of a stroke. A little bit about myself. I'm a paramedic and have been for almost 2 years. I work at Central County EMS, and I have encountered several times individuals experiencing symptoms and signs of a stroke, and I've taken them to the hospital, and I just want to share a little insight with you guys to kind of help you identify that if you come across someone that you think might be having a stroke or a loved one that might be having a stroke. First off, before I say anything else, if something is wrong with a family member or an individual and you believe that they need care, don't hesitate to call 911 and don't use this as an end-all be-all. This is just kind of tools to help speed along the process, because with strokes, time equals brain. So remember that. That's a good little tidbit to remember. First off, recognizing something is wrong may be as simple as the person saying, I have a headache, or they start speaking differently, or they become lethargic or tired, or they fall, vomit, any sort of these things. And the bad thing about strokes is that they can occur all of a sudden without any warning. After you recognize that something is wrong, at that time would probably be a good time to call 911 and get help and get aid, because the faster you get that process started, especially if the person is having a stroke, the more likelihood of them having a successful treatment. A little bit of background information on strokes is that in the year 2012, 220,000 preventable deaths and disabilities could have been prevented if someone had recognized they were having a stroke sooner. So hopefully this will give you some tips there. After you recognize something is wrong, have them sit down, have them lay down. They may become nauseous, lay them on their side. If they begin vomiting, don't let them aspirate on their vomit. There are 3 things that you're going to want to check for. You're going to want to check for grip strength, you're going to want to check their face, and you're going to want to have them speak to you. So first, what you can do is, if they're following commands, which is a good sign, have them grasp both of your hands in their hands and ask them to squeeze as tightly as they can. If there's any deviation in grip strength, if the right hand grips real strong but the left hand doesn't, that may be an indication that they're having some sort of stroke. The second thing would be their face. Look at them in the face. Have them smile for you. I know that sounds kind of like a strange request, but pay attention to the details on their face. Is it symmetrical? When they smile, does one side droop and one side raise? Do both sides droop? Do they both raise? If one side droops a little low, that may be an indication that they're having some sort of event, and that is another symptom or sign of a stroke. And thirdly, have them speak back to you. You can't teach an old dog new tricks. I know that sounds kind of strange to say, but that's just recognizing their speech pattern. Can they speak back to you in a full sentence? Can they speak at all? Do they use inappropriate words, or just what's called word salad? Do they say it backwards or mix the words around? That may be another indication that they're having some sort of stroke. So in conclusion, if you recognize that something is wrong with a family member or an individual, don't hesitate to call, because remember, time is brain, and the faster they can get to the hospital and the faster that you can activate 911 and the stroke services, the faster they can get treatment, and the more likelihood that they're going to save their brain and be able to function properly. So, as I said before, take these tips lightly, and hopefully you never have to use these or never encounter anything like this.